Hello, I'm Dr. Hannah Weir, a senior epidemiologist in the Division of Cancer Prevention and Control at CDC. Today, I want to tell you about our work that was recently published in the journals Preventing Chronic Diseases and Cancer. We projected trends in new cancer cases and cancer deaths in the United States to the year 2020. The purpose of these projections is to provide data to policymakers and health planners to help them anticipate the resources that they will need to screen, diagnose, and treat future cancer patients. In a few years, cancer is predicted to surpass heart disease and become the leading cause of death in the United States. To help us address the growing cancer burden, CDC and its partners developed Healthy People 2020 objectives, which call for a 10 to 15% reduction in cancer death rates between 2007 and 2020. In this study, published in this journal, we predicted future cancer death rates to measure our progress in meeting these objectives. The death rate measures the risk to the average person of dying from cancer. Our projections are important because they predict cancer death rates and the number of people dying from cancer. We use population projections from the U.S. Census Bureau and mortality data from the CDC's National Vital Statistics System to predict many common cancers. We used age period cohort regression models to help us identify trends in younger birth cohorts. We then used these trends to predict cancer rates as these cohorts grow older. We performed these analyses using Nordpred software developed by the Cancer Registry of Norway. Much of the news from our study is encouraging. In 2010, we had a rate of 171 cancer deaths per 100,000 people. Our projections show that overall cancer death rates are decreasing. And in fact, we expect to meet the Healthy People 2020 goal of reducing the cancer death rate to 161 deaths per 100,000 people well before 2020. And we predict a continued reduction in risk through 2020. But at the same time, we project that the actual number of people dying from many leading cancers will continue to increase steadily each year. By the year 2020, we predict that almost 630,000 people will die from cancer that year. In another study we published earlier this year in the journal Cancer, we used similar methods to predict new cancer cases and cancer incidence rates. The cancer incidence rates measures the risk to the average person of being diagnosed with cancer. As you can see, we predict that the overall cancer incidence rate, or average risk, will remain about the same between 2010 and 2020. However, like cancer deaths, the number of new cancer cases is expected to increase each year, from 1.5 million new cases in 2010 to 1.9 million new cases in 2020. Only 5 years from now, we will be seeing almost 2 million new cases of cancer each year. When we look at the leading cancers, we predict that the greatest increase in the number of new cases will be for prostate cancer in men and breast cancer in women. Cancers of the lung and bronchus and colon and rectum will also increase, but the increases will be not as great. We predict that we will continue to see increases in new cancer cases and cancer deaths each year. The reasons for these increases relate to the U.S. population. The size of the U.S. population is increasing, and more people than ever are entering older age groups where the risk of being diagnosed or dying from cancer is greatest. In addition, life expectancy is increasing, and people are living longer. We want older people to live longer, healthier lives, and cancer does not need to be an inevitable consequence of growing older. We can reduce the number of people getting cancer through prevention and the number of people dying from cancer through screening and treatment. CDC will continue to monitor the number of new cancers and cancer deaths. You can read more about our work in these two publications. We also invite you to visit the CDC Cancer website to learn more about our research and our public health programs.